internationally and in Canada, what I see is that the owner handpicks, what I call like a precision team. They handpick, here's a really good process firm, and here's a really good automation firm, and here's a really good architecture firm, or maybe they do CSA and MEP, whatever that circumstance is. And you're able to have these firms work together and coordinate together, and you're able to have a very sophisticated owner to work with them and coordinate them. When you end up having there is really, really high quality and high talent with, maybe mid-sized firms that really care about that client and that project because that's their bread and butter. And an owner getting an extreme high quality service.
Welcome to the Modern Biopharma podcast. The world of today's medicines is big, complex, and constantly changing. Our goal is to give you insight into the people that are manufacturing the medicines people need every day, whether it is the people taking care of these facilities, or those building them, or those maintaining the quality and integrity of every dose that is delivered to the patient. We interview the people that are making it happen and give you a chance to get to know them while we're at it. Thanks for saying hi. Hi, everyone. Welcome to another Modern Biopharma podcast. We're excited today to have Michael Rodionov on from MMR Consulting. How are you doing today?
Good. Jesse, how are you doing?
I'm doing well. How goes the life of COVID quarantine? Are you working from home like everybody else?
I'm working from home. I can see, in the background that unfortunately I don't have a ping pong table like you do in my office, but I'm working from home. How about yourself?
Well, obviously I'm working from home, right?
Yeah, you got a pretty nice.
Yep, and I pulled the shade down just in case my kids peek their head in the window to see if Dad's up here. So, yes, and I play ping pong more, but I'm not very good at doing it by myself. So we do that at 5:00. My kids will be texting me to see if they're allowed to come up and play. So,
you ever had them walk in during a?
Oh yeah.
Yeah.
Yep. My daughter. I was interviewing somebody a couple hours ago, and my daughter walked in right during that. So that's fine. I've been working from home a long time, so I'm kind of used to it. I've had kids come screaming into my office, that somebody was outside. I've had dogs barking like crazy in the background. It's old hat for me. So.
Yeah, I've had my kids come in and during a few meetings as well. So I started locking the door from now on.
Yep, that's what I'm saying. I have as well, and it works a little bit better until you get a persistent 4-year-old that just bangs on the wall. So, anyways, so we're gonna talk about a number of things today. I first wanted to just start with how things changed for you. I met you officially about a month ago, actually.
That's right. Yeah.
North Carolina, and you've worked with our company in the past, and so that's how I was introduced to you. But I met you at an ISPE event a month ago. We hung out at the airport on our way out, and I have been pretty much stuck in my office ever since that day. So how have things changed for you this last month?
Things are pretty interesting. I mean, as they have been for all of us. It's I think at this time we all feel passionate to be somewhat contributing to healthcare and to the pharmaceutical industry based on what's happening. We're probably fortunate, if anything, to be part of this industry, whether it's because we're contributing, to the fight or to the cause indirectly, but also because, we get to be essential and continue operating. So I think things have changed for all of us, and things are not going to be the same for a long time. So, we've all adapted. For us, I know everyone at MMR is, working from home. Very rarely we're going to client sites, and very rarely maybe a couple individuals are going to the office. But for the most part, our office is usually vacant, and most of us folks are working from home. We were already really set up to do remote work because, when you're traveling a lot and going to different client sites, you're already working on clouds for file collaboration and meeting platforms for meetings and that sort of thing. So it wasn't too hard to adjust to working from home. But yeah.
All right. Awesome. Well, hey, let's just do a couple things here. I like to get to know my guests a little bit more personally, if possible. Like we're going to talk about your job and things that you work on, but tell me a little bit about who you are. You know, married, kids. Like to play ping pong. I don't know, whatever. Tell us some details about what you got going on.
Okay, sounds good. So I studied mechanical engineering. For most of my career, I've been working in pharmaceutical or at least in GMP regulated industries. I've got a wife and two kids, a boy and a girl. So pardon me if you hear them, playing uh, in the background. Um, Usually my kids aren't homeschooled, but I can tell you my wife's getting really good at it over the last, month or so.
There's a change for you, huh?
Yeah, for sure. And I know that like our school, unfortunately, it's not progressed to remote education yet. So my wife's just kind of coming up with her own materials and all that to keep them going.
So have you been helping with that, or is you just leaving that to her for now?
I help a little bit, but I'm not going to take the credit for it. There's like 99% her and 1% me coming in once in a while to help
Just
with
make
some
sure
things.
she knows that you helped that 1%. I'm
Absolutely.
sure she'll appreciate it if you do.
Absolutely. Yes.
Ah, that's great. So
Yeah.
you're in your background. You said you were mechanical engineering. Did you go to school? So you're located in what? Toronto, is that right? Toronto?
Yeah, located in the Greater Toronto area, and I studied here. And then for work, I guess MMR is headquartered here, but we have other offices. We have an office in Chicago. We have another office in Raleigh. So I do in Raleigh, North Carolina. So I do travel a bit, and then sometimes we handle international projects as well. Um, so out of essentially that's why we're used to working remotely, because we could be traveling to one place and supporting projects there and other projects. So we're always remotely. The life of consulting is you're always supporting various clients and various projects, and you're adapt
Go where the job is, right?
yeah, you're adapt to working remotely and that kind of stuff.
Yeah.
um
All right.
yeah.
Awesome. So so you said you've been in it your whole career. So how did you get involved in biopharma versus say another industry? Did you go work for an owner? Did you go into consulting right away? Can you tell us a little bit of that history?
Yeah, when I was studying at school, I did some work, like a co-op at a company called Newspark, and they make packaging equipment. They're located in the Greater Toronto area as well. They made packaging equipment really for food, cosmetics, and pharma. And that was really my first. They made packaging and filling equipment, so that was really the first time that I've seen the hygienic design and stainless steel and sanitary standards and that sort of thing. So then when I graduated engineering, I went to work. I worked a little bit in the food industry, and then after that, I went to work in the pharmaceutical industry, and I really liked working in pharma. Um, I worked really the really first year of my career was more operational, where I worked on um, operations management and Lean Six Sigma improvements and supporting production lines and all that kind of stuff. And then eventually after that, after I got a good understanding of GMPs, understanding the shop floor, understanding operations, then I got into process engineering and validation. Um, and then I worked at various companies such as Apotex, which is a Canadian-owned generic pharmaceutical company that makes mostly solid and liquid dose pharmaceuticals, as well as Baxter Healthcare Corporation, which is headquartered in Chicago, but they had a facility in Ontario. Um, and then I also worked for Septidon, which is makes dental pharmaceuticals, and they have a facility here as well as several other facilities all over the world. Um, they're, I think, they have the primary market share for dental pharmaceuticals in the U.S., and they make aseptic as well as terminal sterilized products. And then after that,
I don't know
yeah,
how I'm not familiar with that, even though I know it's out there. I guess I haven't seen that as much. So that's an interesting market I'm not
dental. Oh, I
familiar with.
see. Yeah.
Yeah.
Yeah, if you go to your dentist, you'll see that the little anesthetics, they're in the little cartridges. So you'll see the name Novacol or Septidon on those. I remember when I would go to my dentist, that you'd see the products, right? And then sometimes the same way when I worked at Baxter, and you go to the hospital, whether your wife is in labor or something like that, you see a Baxter IV bag. So it's actually pretty nice as you're or even you say you get a prescription and you go to the pharmacy, and then I would see prescriptions from Apotex that I would use to work for. So it's actually pretty interesting to see, what you're actually contributing to, and then seeing these products being used in a real life, especially on yourself as well. So
Yeah, I agree. I worked for a company called Steris once upon a time, and as a brand, they're a little bit more out in the marketplace. So whenever you would go into a doctor's office, you would see a Steris thing here, and my kids would be like, "Oh, Daddy, that's who you work for." So I always thought that was pretty neat. Even though I had nothing to do with any of the products that we saw in those environments, it was still pretty neat to see for sure. So you did a lot you're not, I think you're not as old as I am. So like you've really done quite a bit. It's a very impressive, got to be with a few different companies here. So tell me some things that you really enjoyed doing while you were there. So what you did at project management, project engineering, you did validation. So talk to me about how maybe you moved in and out of that, and why you liked one thing versus another.
I think I always liked design the most. So I always enjoyed process engineering the most. But then what happened is I guess I was always very ambitious, as you could see. And I always had, I had a big drive. So I would end up being a process engineer, maybe at first myself, but then in a short period of time, I would end up leading a team of process engineers and validation specialists to deliver a project. And then that naturally then made its way into project management and then department management. And so that's kind of how my career ended up where it is. But even as a PM, a very kind of technically inclined PM that's very hands-on with process design and validation.
All right, so this isn't on my list of questions for you, but I'm just curious. So you're very technically minded, and you just said that you really like design, but at the same time, you've moved into roles where you're leading teams. So how have you been able to bridge that gap? Because I think a lot of times people feel like they're either, say the engineer that's doing the design, or you're the manager who doesn't get to do it. So how have you been able to balance that as an engineer manager?
Yeah, it's a good question. Certainly in the early part of my management career, I wouldn't be that far away from it because I'd be managing like 2 or 3 people. So you could still be involved in design reviews and in the projects and what's happening. You just don't have to do all the running around of having to do all the execution. You maybe involved in 30 to 40% of it, right? So I was more of a working manager at that point, and I really enjoyed that, to be honest. And then as your career progresses, you end up having larger departments and larger teams, and you end up doing more staff management and conflict resolution and that kind of stuff. And then what I noticed at that point is when your management responsibilities grow a lot, is you get farther away from the technical work, and that was actually something I didn't like, to be honest. So I'm very fortunate where I am now, that I get to do a lot of technical work and still do some technical leadership and management. So just the right balance of it that you get in consulting versus when you're just managing a big department of people. They could be technical engineers, don't get me wrong, but still it's just there's some weight, there's some administrative weight that goes along with managing a big department of people. So I think everyone has their own preferences of what they like doing.
Yeah, so, certainly. And I don't know if anybody is ever just one, right? You end up going in and out depending on the season of life, depending on where you're at in the company and what kind of projects they have going on. So that's certainly all part of it. So you've done all these different things. What would you say you've done more of? Say more like the big capital projects, or say on the building a facility, or more on the day-to-day when you worked inside of, say, a Baxter, where you just more of a process engineer, keeping things moving, keeping things running well, making small improvements?
When I was a process engineer, there wasn't it wasn't tied to day-to-day operations. It was more on projects. So I was still doing projects. The projects were small to mid-size. There weren't, really large projects at that time what I was working on. But what was good is that I literally got to do everything in a project. So, you'd get to do the design, you would get to manage the project, you would get to do the validation. And then eventually, after you do that a few times, then you start to take on more, and you start to say, well, now you understand the process. What about the utilities that you're tying into? What about the clean rooms, and how are these clean rooms going to be laid out? How's the HVAC system laid out? How's the building automation system laid out? So you start to learn more about it and dig more into it. So what I really liked more about there is it was a small department and you didn't have a lot of structure. So you got to do various types of engineering, whether it was process or whether it was packaging or clean rooms, utilities and facilities and automation. And you got involved in all stages of the project, from the design to the management to the construction to the validation and startup. So I kind of actually really enjoyed that because you got to hands-on do everything, even though the projects might not have been that large, maybe small to mid-size. And then as the career progresses, then you get involved in bigger projects, but at that point, you're not touching as much, right? But then at that point, if you've learned some of those things before, then now you're interested in just scale and integration and in other things, right?
Yeah. So you've been, so I don't know how large these facilities were, but I've been at very, very large facilities, and I've been at a lot of smaller facilities. And I was talking to another guy for another interview recently, and he was talking about his past when he worked for a big company here in the Boston area. And then he moved over to this smaller company, and he said, my first year in this smaller company, he felt like he did more than all of his time in the bigger company.
Yeah.
Because
Yeah.
you're so like, in the bigger the company, the more likely you are to specialize in one little thing, or the project or the process takes a lot longer to get done because there's a lot more barriers and hurdles to get things done just because of the nature of the larger company. So what has that been like for you? It seems like you're saying you got a lot of exposure to a lot of different things. So was that just, your willingness to dive into stuff, or how did that happen?
Yeah, I think so. So basically the employers I work for, as well as then now with MMR, the clients that we provide services to, have been exposed to anything from, solid dose, semi-solids, liquid dose, biotech, sterile pharma, non-sterile pharma, generic pharma, contract manufacturers, small scale, large scale, potent compounds, flammable processing, controlled substances with street values. You get to go to all these different facilities with big margins, small plants, big plants, different types of products, and you get to learn a lot and really apply, all those lessons learned into a practical solution for a client. There's not really one right or wrong way of doing it. It's just what makes sense for that client at that time. And, what you notice is, for sure. I mean, in the smaller pharma clients, you notice that they might not have as many systems and structure. So you might have more flexibility as a consultant to provide them with a design solution. Or if you're working there as an employee, you get to learn more while you're there. In a large company, though, you might get to learn something about a really large, complicated project that the smaller company might not have had a budget to do, but you're going to get to do the design of that or the validation of that, and that's going to be your scope. And you're not going to also, do all these other things, right? You're going to do one or the other. You might not do as much. So I think there's good things to learn from all of them. I wouldn't maybe discredit any of them, and it's to everyone's liking. I think it's a case by case. There are some small companies that are growing, and then sometimes you can get a great learning experience in those. And there are some big established pharma companies that, are coasting. So you might not get that big project experience there. So it really depends on kind of a case by case of the different dynamics, at that time.
Yeah. So something I'm always interested in when I talk to people is, what kind of things they've seen change in their time in the industry, whether that's, on a macro sense, like the kind of therapies that we're seeing being developed. I mean, that's obviously a big deal, but even on the smaller end, like, I don't know, you're really involved in clean rooms and clean room design, and that might be, this huge change. Like, that's happening in the industry that you think, is really, revolutionary. So I'm interested in that from your perspective, having seen and touched a lot of different processes over the years.
Yeah, I mean, I'm seeing various things. I think like the bar and regulatory compliance continues increasing. That's one thing. I think technology innovation in pharma continues to increase, which is good. And then I think that lately what we're seeing is the scientific innovation, with all these new gene and cell therapies and mRNAs and all these maybe next generation medicines that's also innovating. So you see these various trends happening at the same time. Possibly the next trend that we're going to see is less globalization.
Yeah,
so,
right.
in terms of what we're seeing on regulation, regulatory and compliance requirements getting more stringent is you'd have, let's say, auditors that come from a sterile biotech world-class facility that come and audit this 70-year-old non-sterile pharma plant that's making a low margin product, and then they come with this big mindset because they just came from the gold standard, and then they're applying similar principles. So it becomes very interesting, and how do you defend certain things and audits against those? And I've had experiences doing those, and so I think that was actually fun. I found it pretty fun working for some of these smaller or older plants that didn't have deep pockets, that didn't have the state of the art, and you have to defend that to an auditor, because I think then you really understand what's actually required versus when you're doing something new and you have deep pockets and you're just going to go on a shopping spree and get everything, get the Rolls Royce. So I don't know, I was actually found that pretty fun and intriguing, working in the smaller pharma companies, because it's more challenging, I think.
Yeah, I actually was, I visited a hopeful client not that long ago. And we were looking at their water system, because I do water systems, and they were explaining their take on their new water for injection system that they're hoping to build. And as they're explaining it to me, I was honestly very surprised, because the way they intended on building their new one, I'd never seen anything like it before. It didn't follow any guidelines that I've ever read. And he was like, "What do you think?" And I'm like, all I can tell you is I've never seen that before. And he's like, "Well, we've been monitoring our current one and all the numbers are great and all this stuff." I'm like, "Yeah, and that's
generation?
wonderful."
Generation equipment?
It was generation equipment and distribution equipment, all of the above. And I'm going, never seen anything like it. But yeah, if your numbers are good, then, and you want to stand up to, auditors when they come in and take a look at it, then, be my guest. I mean, I can't tell them not to, but not following any ISPE guidelines or even BPE guidelines for equipment. I was like, but if it meets all the numbers and you got the data to say that it's going to meet it, then there's no reason you can't do it that way. It just, you're kind of all out on a tree limb by yourself there. That's all.
That's pretty interesting that you bring that up, because one of the reasons I like working on water systems and then on process utilities, such as CAP and stuff like that, is that they're very common in a lot of pharma plants. So, water systems, most pharma plants will have them, unless there's something really small and they're buying water in bottles or something. It's so rare these days. Most pharma plants will have a water system of some type.
Mm-hmm.
And then a lot of them will have some type of CIP system. Even solid dose plants these days are getting into wash and place systems with some of the newer technologies that are out there. And, for some reason, these clean utilities and process utilities, I don't know, maybe people think they're really easy. So they don't give them a lot of attention. And you just see these, very kind of preliminary or just fundamental, hygienic industry fundamentals of what not to do in a water system or in a CIP, distribution header or something like that, being done at some of these places where, points of uses are non-drainable or don't get sanitized, or there's dead legs, or they're, have low velocities in their distribution loops, or, they don't have safety or quality critical alarms or loop managers, or there might not be trending certain data, which might be pretty critical data to a water system. For a lot of water, a lot of plants, water is like the heart of their plant. a lot of the liquid dose plants, that's the main raw material. And it's also used for the final rinse of CIP. For a lot of the other plants, it's an important, material and buffer, and it's also, used for the final rinse. So it's so critical, but a lot of times it's not given much attention. So that's kind of been one of my, passions, is working on clean and process utilities, is because you see there's such good ways to design them, better than maybe the average design. But then also the average design a lot of times is also really poor, and you see a lot of clients suffering from like micro or bioburden issues from just something so basic. I think the most common one is having micro bioburden on point of uses because they're not sanitized or they're not drained after they're sanitized. Completely, fundamental things. So
can I ask a question about that one for you?
yeah,
Just real
yeah.
quick. So like when you see something like that, is that just because they don't have the right processes in place? Is it because, I guess I'm just trying to think about what the
It could
most
be so many.
usual, most kind of, they build it wrong just to begin with, or what kind of things do you see?
It could be so many different things, right? So I think, the design firm, their scope might have been process and piping. So they might have set up the process and piping, and then the automation firm maybe needed a functional spec. And I don't know if that was in scope of the design firm or not. And maybe it wasn't. Maybe the automation firm was developing the functional spec. The automation firm might not know how a water system is supposed to function inside and out to actually do that really well. Or maybe the owner was doing that. Or maybe it was left for the owner to do at a later date. It's so hard to say why a lot of these things are done. Sometimes the valves are in place to do some of these things, but about half the time the valves are not even in place. They weren't designed from a process and mechanical standpoint. You cannot drain and sanitize some of these points of use. And it sucks when you see that on a new installation that's 2 years old or something like that. But I still see it happening to this date. And I just think that I still see it where water and CAP, they don't get enough attention. People just think of it as simple. You put in this generation still, you put in this tank, it circulates water. But you don't manage it properly, you get endotoxin, bioburden, you get really big issues on an important raw material and an important, something that you use for CIP and for final rinse. So, yeah.
So when you work at an older facility and you have to go in and try to help them with whatever, with an upgrade, with an expansion, with whatever, like how do you go about making sure you have the right stuff in place? And just as an example, like I in my, maybe 2 years ago now, I was working at a facility. They had some GMP manufacturing, but they worked off some old utility loops. And they kept expanding and they were growing a lot, but they would end up with these, times where they'd be doing particle counts and stuff on their loop, and or their TOC meter would, shoot up and be like, whoa, what's going on? They'd have these high spikes, and I'm talking over and over, and they rinse it all down and they do a clean of the loop, and then everything would be good, and then all of a sudden it'd be bad again. And at the end of the day, we ended up finding out that they had like a ladder system in their loop. So like basically they go up, like out this way, over and down, and then they'd have all these little cross, pipes through the loop with valves in the middle turned off. And what was happening is that valve was starting to break down. It was,
so they're pulling a vacuum sometimes.
Decades old, and they wouldn't have return. It was really bad, and it was just something they didn't realize because it was sort of hidden. Nobody knew. I mean, nobody knew. None of the facilities.
It wasn't in a drawing. Yeah.
Nope, it wasn't in a drawing because it was old. They didn't even have good drawings anymore. So how do you go about an old facility and figure some of that stuff out?
I mean, that's at least
without it being so much work,
Yeah. Well, I mean, it's a case by case, but at least half the times, the types of work that a smaller consulting firm like us would get is, here's an existing plant, we have a problem. It's not going to be, I'd say at least half the time that's what it's going to be, right? Because we like to do those kind of smaller projects, and we're going to be very detail oriented with those. So, we're going to survey what drawings do they have. If there's some drawings, they're probably not going to be the most accurate. we'll talk to their operators and their engineers, and that's a very critical part of it, and their maintenance guys. We'll do a walkthrough of the system. And then what I like doing too is doing a diversity study to really understand, their usages and consumption. When you talk to someone about, a big CAP distribution system or a big WFI, distribution system, operations will always tell you there's not enough water. We're running out all the time. And, it's interesting to dig into the details and see what's actually happening, right? And, we do like a diversity study where we analyze what's the consumption of each user and which one's drawing at peak and all that kind of stuff. And we add, then we trend some of the data and compare it to how often are these peaks happening. And what you'll find is the really bad peaks maybe happen once a week, and they might not need to happen, where you're draining a tank all the way down and you're slowing down production. If there was maybe a loop manager in place that would marshal all their consumption and they would simulate their process and plan their process properly. So I think it's just maybe doing some of that analysis to understand what do they think they're doing, what are they actually doing, why are they doing it, and what should they be doing to come up with a solution. Because a lot of times, everyone's jumping to, we need a new tank, we need a bigger tank, we need bigger pumps, we need a bigger loop. And I'd say at least half the times, the solution is put a loop manager in, put some extra alarms and controls in, marshal your consumptions properly with automation. I'm not saying manually by SOP in a big loop, but come up with some type of a good automated approach to manage, the system. And I think that would be good. Now, for what you described, which is PM and micro issues and all that, we see those for sure. With some older designs, you see that kind of stuff. But then you still sometimes see that with some newer designs. If not everything gets sanitized, then there's dead legs and not everything gets drained, and there's water sitting after POU got sanitized. So you kind of deal with those on a case by case. Sometimes it's an automation change to make sure you sanitize and flush and drain things. And then sometimes it's an actual process mechanical change to add some extra valving in place, stuff like that. But to get a really robust, water system, for example.
Interesting. Yeah, that's going to be a big job every time, and got to figure out the balance of how far in you can go without it being too much. So
what's interesting though is the technological innovation that we're seeing, like the single use and disposables, they're becoming I guess they've gotten debugged a bit since they came out, so they're becoming more practical. When they first came out, the connectors weren't connecting really well, and so it sounded really good in theory, but when you practically go use it, it was a nightmare. But then now that there's been some trial and error, that's actually becoming very a very good technology. But you just have to do your ROI analysis and when it makes sense. It usually makes sense for a smaller plant, and it might always make sense for a very big plant. Very big plants are still usually steel. And you do your ROI calculation. When does it make sense to do that versus when is it not? Continuous manufacturing, you see that sometimes. You see hybrid plants that use some batch, some continuous, some semi-continuous, and that's pretty interesting. Functionally closed processing, has really made a lot of headway lately. And I think it's got extreme, right? It's got to put all your process equipment into grade C rooms, into separate rooms, into get a non-classified hall where you can never do an intervention, into something in between where your part of your equipment is on the non-classified side, and maybe there's just a thin corridor with enclosures around the manways on the classified side, so you can still do interventions into a really important batch in a key process equipment, and maybe just the buffers are not. So it's actually really interesting how technology advances, but then design application of how we apply the designs advance through time. Process modeling and simulations of plants is pretty interesting. What you'd notice, I guess, when you do some process modeling is that, in the original design, you think that you need X amount of CAP skids and X amount of utilities, but then you do this model and simulation, and you can really, increase equipment utilization and decrease how many CAP skids you need, how much footprint you need, how much piping you need, how much, and saves a lot of cost. So, the technology innovation and just how people are applying it and using that is really interesting.
Yeah, I think that's something that we're going to continue to see better and better for sure. And when you go into older facilities, you see stuff that's way oversized because they just never wanted to get caught, without enough.
Yeah.
And honestly, even beyond the pharmaceutical, I used to work from a water perspective. I did more in the healthcare, like in a hospital, and they'd have a water system for the hospital that, it was huge, and all the users, they're just sipping on this loop. There's barely anything coming off this loop for the most part, but they just never wanted to not have enough, and so that's just the way they built
You know
it.
what, and that's fine. There's nothing wrong with that. If you want to put a massive pump and a massive pipe and circulate that thing, as long as you have all the controls in place, you've got back pressure control, you've got alarms in place, you're managing your consumption. Go for it. Put in your monster loop and have almost no draw. I think that the issue is, if someone wants to spend more money than they want to, that's up to them. But it's more of when you put this loop in and you run it dry and you have low return pressures and you're vacuuming particulate matter back into the loop, and you're not sanitizing and not draining things, and just fundamental hygienic issues. And when we work in healthcare, you want to kind of not have that kind of stuff, because these are pretty important products that we're making, and water and CAP is pretty plants systems that are used in healthcare and pharma plants.
Yeah. All right, so let's I just want to move on to another question for you. And you've probably talked to this a little bit as we've gone, but I'd like to just know, what's something that when you look at how you do business, how you run projects, something that you'd like to see an improvement in how we build our facilities, how we go about doing what we do in the pharmaceutical industry?
Mm-hmm. I think maybe some things that I would be nice to see an improvement on. I see these done. It's more of like the project delivery model. Internationally and in Canada, what I see is that the owner handpicks, what I call like a precision team. They handpick, here's a really good process firm, and here's a really good automation firm, and here's a really good architecture firm, or maybe they do CSA and MEP, whatever that circumstance is. And you're able to have these firms work together and coordinate together, and you're able to have a very sophisticated owner to work with them and coordinate them. When you end up having, there is really, really high quality and high talent with, maybe mid-sized firms that really care about that client and that project, because that's their bread and butter. And an owner getting an extreme high quality service. And what I'm noticing kind of in the US at least is that a lot of the projects go to, maybe one large firm. And then what I'm seeing is the owner has a very, very beefy internal team, because they need to make sure that they peer review and sign off on every, a lot of the documents. I just think that if if the industry learned maybe, from how projects are maybe run internationally or in Canada, where you're handpicking more of a precision team, how do you coordinate that and have that delivery model also being used in the US, because it's not very frequently used. I think what folks are worried about in the US, usually just based on the litigious nature of the US, is who takes the liability, who's going to take responsibility. And there's many ways to skin that cat. I think in some cases, various firms have various, liabilities, responsibilities. And if if the client gets used to working with them, then these firms will almost self-coordinate with each other. It's not necessarily the client's responsibility to coordinate all of them and every submittal between them back and forth and get them to dot their I's and cross the T's. And so I think that's
an important thing you just pointed out, because I think sometimes the expectation or the thought is, like, if I have all of these different groups, how are they going to work together? Because who's in charge? And I think the thing is, well, if we just give it to this one big firm, they got all these different groups, then they're responsible for it and we'll be fine. When in reality, people work together. We're not always looking to blame everybody else, right? So
yeah. And so
my little company can work with that little company, and we can talk to you individually or together, right?
And I mean, the big firms, they do a good job internally of having, their different disciplines meet and their different disciplines coordinate with each other, and project managers coordinate them and that kind of stuff. And the same way, you could have the discipline leads from different firms that are highly specialized meet with each other and have a coordination meetings outside of the client and coordinate, with each other, so that they can give the client a very high quality of work that they're very passionate about, because that client might be really important to them, and this project might be really important to them. So they're going to make sure that they all work together as a really good consortium team and do a very good job for that client. So I've seen that model internationally, and that model is close to exclusively used in Canada. Not always, but close to exclusively used in Canada. And it's very different than how projects go in the US. And I can just see a tremendous difference in quality, where you have folks that this is their bread and butter, and they're always looking for your best interests. And if you got this process firm that's been doing work at this site for 10 years or 15 years and really know this, the site inside out, they're not just coming in for the first time to do this project and then they're off. You just get a complete different type of service. Yeah.
Well, that's a good. I like that. That's a good feedback, and it's a good idea. I mean, I don't know if I've heard it really presented that way. Say in the industry in the U.S., I do a lot of ISPE type things. When I hear project delivery models, ultimately they're trying to make the best of whatever situation the project has, right? So this is what the client decided. So how do we best do it from here? Rather than, what are some different ways we could choose our team and whatnot to deliver the project. So that's good. All right. So I got a couple more questions for you, but just got to keep us moving. So you've talked about a few of these things already, some things that are kind of exciting, changes you've seen in the industry, but what's something that you specifically are excited about that's happening in our industry right now?
I mean, gene and cell is exciting. mRNA is exciting. It's great to be part of the industry and see these new, innovations come through. It's interesting to see too, new technologies come through, like the use of disposables is becoming more and more often. For water, it's interesting to see membrane WFI, now that EP has changed their, guidelines and regs, that you're seeing more membrane WFI in the US, which is great. You're seeing ozonated WFI loops, in the US, which is great. So you're seeing some of these innovative approaches that we wouldn't have thought of doing something that way, before, come through. And it's actually pretty fun, doing these things on projects and doing things differently, and not just kind of, how do we do it before? Put this, WFI still, there's pure steam generator in, put it in the tank and circulate it and keep it hot all the time. Just seeing new approaches and new industry innovation come through.
So what do you think is maybe driving some of that change? So the EP on the water, I'm water focused, but so EP changed their regulations, but there's been sort of that sort of industry, pushback on some of those changes. And now it's starting to take hold and starting to happen. Is it just that the regulations were relaxed, or do you think there's more to it than that? Like, what's maybe driving some of those changes on the waterfront, like you were talking about?
Well, I think, it's kind of a case by case, but I think, cost is driving some of it. And it's interesting because I've done cost analysis on, using ambient BC stills to generate something like, cold WFI, for example, or using a membrane WFI system to generate it. And, you look at costs, for example, cost and redundancy, and what makes sense for the client. So I think, what's driving these technologies a lot of the time is the cost. cost and maybe redundancy. So, if you have a plant that's using a lot of cold WFI, big volumes of it and all that kind of stuff, then it probably does make sense for you to have a membrane WFI and have something separate for the hot WFI. But you just have to figure out how do you deal with redundancy, right? What I've seen a lot of times is you have then the VC stills that can switch between ambient and hot, and you could maybe have those serve both. So you have your membrane WFI for cold, and for PW, and you might have your VCs or multi-effect, whatever makes sense in that case for the hot. You might have like a hybrid VC that could do hot or ambient and serve both parts of the plant. So like an approach like that would be pretty interesting, where you can get redundancy in both, and you've got different technologies, and you're saving energy. You're saving cost, you're saving CapEx cost, you're saving OpEx cost. In general, it's pretty interesting to see sustainability and sustainable utilities come into play into pharma. Pharma, a lot of the times, it doesn't focus as much on energy in that. And so with some of these technologies coming into place, it's not just the CapEx cost, it's also the OpEx cost and energy savings and being more sustainable that gives us the ability to do that with membrane WFI or with ambient VC, for example.
Yeah. Interesting. Yeah, I agree that the energy savings I've not seen that to be the highest value in the pharmaceutical, especially in say the higher margin products, biologics and things like that, versus maybe some of the stuff that isn't done in the United States and Canada as much anymore. So that's definitely something I've seen. So, although who knows with COVID, with like you said, globalization maybe getting a little beating right now, and maybe some of that stuff will come back here a little bit. All right, so I got one more question for you. I've been fascinated by hearing the different kind of answers I'm getting from people, but what is something that or some things that you would tell yourself 10 years ago? And again, this is professional related. So what would you tell yourself in this work that you're doing now, or the work you were doing then, that your older, wiser self now knows that you'd love to be able to share?
Yeah. I think I would probably tell myself, do what you like doing instead of striving to kind of, climb the corporate ladder and increase your compensation as rapidly as possible. And then with that, when you do what you like doing, everything else just automatically falls into place. And what I really mean by that is like I always, like I said, I love doing the technical work, but I've had interpersonal skills, and I always like kind of chatting with people and getting along with people and all that. So that just somehow naturally put me in the manager level at a pretty young age. And then I was kind of climbing into management, pretty quickly. And then what I noticed, at the end of it, like I said, is when your responsibility grows and grows and grows, is the role becomes more administrative and less technical. So then you end up, thinking, why did you get into engineering? What are you kind of doing now? That how are you still going to stay, attached to what you like doing? People will just think that you're a micromanager when you're managing 30 people and you start going into design meetings and reviewing P&IDs and stuff like that. That's no longer part of your responsibility. You shouldn't be doing that. So, I really found I was really caught at that point. I'm like, how do I like leading technical teams, and doing that, but I also like doing the technical work. So how do I do that? And then where I really found the balance is in consulting. That consulting's really allowed me to do that. So being, a principal at MMR Consulting, a founder and a principal, I'm really happy here because it gives me that blend of doing technical work, doing management work. And I also like, meeting with different clients, understanding their problems, and helping to come up with with the right solution for them. That a lot of times is not building something new or changing or spending a lot of money. A lot of times it's a simple fix, like an automation fix or an SOP fix or adding some valves or something like that. Sometimes it is a big change, but I really like that problem solving that I get. So, and I'm glad that now eventually my career has taken me here where I'm really satisfied and can really help clients a lot.
Yeah, I think I think your role is a pretty unique one. I get to, meet with a lot of people like you in my job, but I think your role is a really unique one, and I've enjoyed getting to know guys like you who are running firms, design firms, and engineering firms, and automation firms. That especially the entrepreneur side. So you guys are kind of making the business happen all at the same time. You're actually working technically with the customer. That's a very unique role, and not a lot of people can even handle it, right? So that's great. Well, this has been very fun, Michael. I'm glad we got a chance to do this. I hope we get to do some more of this in the future. I'm looking forward to maybe seeing you down here in the Boston area. I know we have our show coming up in the fall for ISPE. I'm sure I'll see you then, but maybe get you involved here in the Boston area with some of the projects we have going as well. So thanks so much for being on here today, and I look forward to talking with you again.
For sure. Likewise, Jesse. And, I've worked with Aquachem several times before, and, look forward to continuing to kind of work with you guys on several projects. So thanks for doing this and for organizing this, and hope you have a great day and stay safe with your family and play a lot of ping pong.
Yeah, we'll do. All right. Thanks.
Yeah. Take care. You too. Bye.
Thanks again for listening to the Modern Biopharma podcast. Please reach out if there is someone you'd like us to interview or a topic you'd like us to discuss. We will make it happen. And don't forget to like us on iTunes or subscribe on YouTube. It helps us get the word out. See you next time.